Head injuries in children are relatively common, and each year more than 1 million kids sustain a minor or severe head injury. Falls are the most common cause of head injuries, and parents need to know that 75% of deaths after falling off playground equipment occur from head injuries sustained in the fall. Now, minor head injuries usually require little treatment, but parents should take caution to make sure the head injury does not worsen in the days that are immediately following the incident. Well, Dr. Howard Yonas is chairman of UNM's Department of Neurosurgery and joins us with more important information. Hello, Dr. Yonas. Thanks for being here.
Good morning.
This is something that can happen at any given time, and it's really important we cover this subject. So I want to talk first about what types of problems a neurosurgeon actually cares for so people understand.
Neurosurgery is an enormous field.
It is.
It covers the entire nervous system, from the problems in your wrist to the pinched nerve in the neck, to the blocked artery in the neck, to the aneurysm that bleeds in the brain, to the brain tumor, and to all those accidents that are the common thread that we all care for every day.
So what exactly is a brain injury, and how specifically is it diagnosed?
Well, you know, the easiest way to think about a brain injury is when you look at your bowl of Jell-O, and you shake the bowl very hard.
Yes.
And you imagine the Jell-O slashing around.
Well,
your brain does the same thing.
Wow. Oh my goodness.
And so the brain jiggles not only front and back, which can tear things, but it does something terrible. It can swirl. So if you hit it at the glance, the brain is, and it's just tearing little connections throughout the brain.
Wow. You know, I don't think people realize it in those terms. It's a scary thing. And then there's, you know, mild to severe brain injuries, obviously, that are very common in young athletes. We hear about that a lot. We also hear the fact that toddlers are always bumping their heads. You know, they're running around, they're playing, they're learning to walk. So what would you say are some of the symptoms that people and parents need to look out for?
Well, the things we need to be thinking about is what's the mechanism of injury? Is this a high-speed accident where the child was thrown out of the car? That's totally different from the child that falls from a car seat that the mother's carrying and the child falls a few feet. On the other hand, if the child is 2 months old and the child falls 3 feet, that can be a very severe head injury. You can fracture the skull and you can cause bleeding. So what we're really looking for is any alteration of the child's behavior, and the mother and the father are the most sensitive. Is the child back to normal? If the child's not back to normal very quickly, then our degree of worry continues to go up. It increases greatly.
Sure, and then once we take that child to the doctor, how are these brain injuries treated?
Well, the next thing is, the question is it a significant injury?
Right.
So a mild, which means the child really didn't lose consciousness, maybe a little stunned, started crying, but maybe fell from a distance and everybody's worried. He's a little fussy, he's not quite the same. We're now talking like a newborn or even up to two years of age. Children are far more prone to have a significant injury that could be missed because clinically it's not as obvious.
Right.
Over 2 years of age, up to 18 or so, it's obviously we're more sensitive to subtle changes. The strength isn't the same, speech isn't clear. Headache, persistent, terrible headache. So a little child, that could be just terrible fussiness. The next thing we worry about is throwing up if the child is unable to keep fluids down. And then it gets into the situation of should the child go to the hospital? When any doubt exists, the answer is of course.
Always yes.
And the next question is, should we do imaging or should we watch a child? Should we do scans or can we just watch for a few hours? That has to do with that history of exactly what the mechanism was, how the child responded, is the exam back to normal.
Okay. So there's a lot to look out for, and obviously you can help, but can you just give us a brief idea of how we can at least protect our brains against injury?
Well, I think the thing to remember is that every injury is additive throughout your life.
Yes.
So even a mild injury, my son played soccer and he was very good at it, but he headed the ball a number of times and ran into other players. And now he's a professor, but he has a disability. He has a learning disability because of the additive injuries he had over the years.
Wow.
So we really want to avoid significant impact to the head by any mechanism, because it's not only a single event that you get over that event from the first one hangs around and adds to the next one.
Right.
And they
So
keep building over life.
you become more vulnerable to each and every one. Well, thank you so much for shedding some light on this important subject, and hopefully if anybody needs any of your help, hopefully we keep everybody safe from brain injury, but if they need you, they know exactly where to contact you. All those details on our screen, and we'll have this segment on our website at casa.com. Dr. Yonas, thank you so much. It's a pleasure to have you.